Hi, my name is Jordan Coiner from the Springfield-Greene County Health Department. Today I'm going to walk you through our new dashboard update. Based on feedback we've gotten from the community, as well as the hard work here at the health department, we've got some exciting updates for you. Most of this information is updated on a daily basis, but will be noted if not. Here at the top, we've included confirmed case information. You'll notice on the far left in the yellow box, we have our total number of cases. We look to the CDC's guidance for the tests we should use in these confirmed cases. We include PCR tests, antigen tests, and LAMP, which is another type of PCR test. You'll also notice on the far right here, there's an epi-linked death included in the total number of deaths. This simply means that an epi investigation was done to confirm that it was a COVID-19 death, but there was not a lab result to also confirm that. Here is the Greene County Hospital information. On the left is the total number of patients hospitalized in all of Greene County's hospitals. On the right is the number of those patients who also live in Greene County. Below that, we've included testing information. On the far left, you'll notice the total number of tests in Greene County since the beginning of COVID. To the right of that, we have our most recent reporting period. You'll notice that this is a 2-week lag. The reasoning for that is because it takes time for the negative test results to come through the system. So we've noticed that it can take up to 2 weeks for those results to come through and for this positivity rate to stabilize. Below that, we have our community indicators. We show a 1-month view. In this chart, we have our daily cases reported, along with a 7-day rolling average. 7-day rolling average just looks at today's date and the previous 6 days to average out the number of cases reported. And we do that over time. To the right of that, we have our percent change. This percent looks at a full week's worth of cases reported and then compares that to the previous week. Below that, we have our 2-week case rate per 10,000 people. We use this type of rate to be able to compare our population to another population across the state or the nation. To the right of that, we have our Greene County Hospital information over time. At the very bottom of the page, we've included our capability dials. This includes hospital, public health, and testing capability scores. If you hover over the dials and then hover over the question mark, you'll notice a definition for each. So on the Case Overview tab, we've included the same information that was on the Main Page tab, but we've also included a date slider here. This allows you to view the information that you want based on the dates you're interested in. So we've included the daily cases and the 7-day average, the 2-week case rate per 10,000 people, the Greene County Hospital information, and then at the very bottom, which is not controlled by the date slider, we've included the cumulative confirmed cases over time, as well as the active, deceased, and released from isolation numbers over time. To show you how the date slider will work, you can click inside the box and choose the date of interest, and the charts below will automatically change. Or you can simply grab the dot and slide it, and they will also change. Moving on to the next tab, we've included testing information. Here at the top of the page, you'll notice an overall summary of all tests completed in Greene County. We've got the positive tests, negative tests, and positivity rate. Below that, you'll notice that we have the most recent reporting period again, with the test completed, positive, negative, and positivity rate. We also included a chart here at the bottom, along with a date slider, to allow for you to choose the dates of interest and view the total test negatives, positive, and positivity rate. You'll notice on this chart that we have two different axes. The left axis, which is just numbers, goes along with the gray and blue bar charts. The right axis, the percentages, goes along with the yellow line for positivity rate. On this next tab, the demographics tab, we've included age, average age by month, cases by race, as well as case rate per 10,000 people based on race. This is another rate that allows us to compare population groups, but this time within Greene County. You'll notice at the top of the page, there's a month filter. If you drop down, you can choose the month that you're interested in. And the top three charts will automatically change to that month. This very top chart also allows you to look at only ages that you're interested in. So let's say you're interested in only K through 12. You can look at ages 5 through 17, and you'll see all of the cases in September that are ages 5 through 17. To change this back, you can just slide each of the sliders all the way to the end. And to clear the month filter, you'll notice an eraser that pops up here at the top, and you can just clear all selections. Here on the last tab, we've included regional information. On the top chart, you'll notice we've included Springfield Metropolitan Service Area case counts, as well as Southwest Region case counts. The Springfield MSA is made up of Greene County, as well as surrounding 4 counties. The Southwest Region is made up of 33 counties that are identified by the Missouri Hospital Association. Below that, you'll notice that we've included a rate per 100,000 people this time of similar cities and counties to Greene to allow for comparison. We've also included a rate change within the last 2 weeks to show which of these cities or counties may have an increasing number of cases. At the very bottom of the page, we've included links to other websites such as Missouri Hospital Association and Missouri DHSS's website. We'll be adding links as more information becomes available. We hope you enjoyed our dashboard update. You can find it at our website at health.springfieldmo.gov/coronavirus. Thanks for watching, and stay strong, Springfield.